Hi, I'm Martha. I'm a London-based women's pelvic health specialist and physiotherapist, and one of the medical experts in the Luna Daily Collective. Up to 9 in 10 first-time mothers who have a vaginal birth will experience some sort of tear, graze, or episiotomy. Today, we're going to learn about perineal massage techniques, which help to prepare the perineum for childbirth and reduce the risk of tearing. The perineum is located between the vaginal opening and anus. Massaging the perineum makes it more flexible so it can stretch more easily during labour, reducing the likelihood of tearing. This guide will teach you how to do perineal massage, either by yourself or with a partner. The idea is to stretch the perineum and make it more flexible. We'll be using the perineal prep oil from Luna Daily, whose unique blend of grapeseed oil, jojoba oil, avocado oil, rosehip oil, and almond oil works to replenish and hydrate the skin, as well as improve elasticity. Now, before you begin, you should avoid perineal massage if you have vaginal herpes, thrush, or vaginal infections. Here's our step-to-step guide. Now, I'd like you to prepare your space, wash your hands thoroughly, and make sure you or your partner, if they're helping's fingernails are short. Find somewhere you can relax, uninterrupted, and in a private setting. Make sure you have your Luna Daily Perineal Prep Oil and your mirror to help if needed. Find a comfy position with your legs open wide and your knees bent. Now, a few positions to try. Use some pillows to prop yourself up on a bed or a sofa so you or your partner can reach your perineum. Another option is reclining in the bath. You can use a pillow or towel for comfort for your head, with one leg up on the side at a time. Standing in a warm shower is another option, with one leg up on a stool or chair. You can alternate the legs during this position. Now, I'd like you to lubricate your perineum. Put some perineal prep oil on your perineum on the lower part of your vaginal opening. This will help to lubricate and moisturize the tissues around the perineum. Using one finger or thumb for your first time or for the first few sessions, depending on your comfortable position. You can use one finger or thumb and insert no more than an inch, a knuckle, into the perineum. You want to imagine the bottom area is 6 o'clock and the sides are 3 and 9 o'clock, using these landmarks as you take some deep breaths. Press down towards your anus and sides and hold that tension for 45 seconds, breathing in and out as you sweep up to 3 o'clock and return back down, repeating this for roughly around a minute. If you're doing it with one finger or thumb, swap hands for working on the other side, which would be again the 9 o'clock position. So pressing down at 6 o'clock and sweeping up to the 9 o'clock for another minute. Now, another option and a more advanced option is using both fingers or thumbs. You want to relax and start the massage. Taking some deep breaths in will help you relax into a comfortable setting, in through the nose and out through the mouth. Now, using your thumbs and inserting them roughly around 2.5 centimeters just inside the back wall of your vagina. You might find it easier to use a mirror. Then place your 4 fingers on your skin of your perineum. You want to be pressing down towards your anus and to the sides. You should feel a bit of a burning and a stretching feeling, holding this stretch for roughly around a minute. Now, using your thumbs, you want to massage upwards and outwards and back again, using a U-shaped sweeping movement, aiming again for the landmarks of 3 o'clock and 9 o'clock. You can do this approximately for 2 to 3 minutes. Now, perineal massage shouldn't hurt you, though you may feel a little bit of pressure in the first few weeks of starting, and this should ease as you progress through the pregnancy. Now, using your partner, it can be a nice way for them to help you do the perineal massage as you get closer to your due date and as your bump gets bigger. Now, simply follow the same method as before. The only difference is that your partner should use their index finger rather than their thumbs to perform the side to side and the U-shaped downward pressured movement. I'd like you to keep up the routine. Try to do this 2 to 3 times per week during the final trimester, roughly from the 35th week onwards. My advice would be for you to slot it into your normal routine, for example, during or after a bath or a shower. This is a really good time because your blood vessels in the area are already dilated, making the perineum softer and more comfortable.